Let's talk about surgical treatment options for erectile dysfunction. So this is generally for men with severe erectile dysfunction where the pills are no longer working and the injections are either no longer working or the patient just doesn't tolerate them or doesn't even want to try them. So for these men, you basically need to have a penile implant or a penile prosthesis. And there's two main types. So one is the inflatable penile prosthesis, or IPP. This is essentially a three-piece device that's surgically implanted. So you have these cylinders that go into the penis that 99% of the time they're empty and flaccid, but they're connected to a pump that goes into the scrotum next to the testicles. And the pump is connected to a reservoir or a small balloon that gets put in the pelvis near the bladder. So all of this is connected by tubing. It's all underneath the skin, so nobody can tell that you have it in. And so when the patient wants to have an erection, they find this pump in their scrotum and they squeeze it several times, and that pushes the fluid from the reservoir into the cylinders, giving them a solid erection. It stays up as long as they want to, and then when they're done, they push the other button on the pump and causes the fluid to go back to the reservoir. So this is really a great option for a lot of men. It's been in practice and clinical use for over 50 years, and it sort of mimics the normal physiology, meaning that the penis is usually soft, flaccid, and out of the way when it's not being used, and when it's time to use it, it gets a really rock solid erection that stays hard as long as you want it to. Now, the downsides of the inflatable penile prosthesis are one, this is a mechanical hydraulic system. So it will eventually break down just like a car. On average, it lasts about 8 years, but sort of like a car, depends how many miles you put on it and how hard you drive it. So when the device breaks, you can either just leave it there and continue living your life without sex, which is okay, especially if at that age you're no longer very interested in sex, or you can have another surgery to remove the device and put a new one in. But again, that's another surgery that has the risks associated with it. Biggest risk that we all worry about as urologists putting in penile implants, especially the inflatable type, is an infection. If you get a device infection, it's really a nightmare. It's not just, oh, you're going to take a week of antibiotics and get better. It means you have to have another surgery to basically remove the entire device. And the infection risk is, in most of the literature, roughly 2%. So not very common, but if it happens to you, it's really a nightmare. The other downside with the inflatable prosthesis is that the patient has to really interact with the device. You have to be able to find this pump in the scrotum and squeeze it several times to push the fluid into the cylinders. And there's no electronics here. The fluid is moving by the power of the patient's hand. So it can be quite a firm squeeze that's required to get the fluid moving. Some patients find this uncomfortable or difficult to do, especially in the initial period after the surgery, but most patients are motivated enough that they can figure it out and get it to be inflated. Same thing with the deflation. There's a separate button that has to be pushed to be able to deflate the device, and obviously the patient needs to be able to demonstrate that they can deflate the device on their own before you give them the green light to inflate it. So the IPP, in my eyes, is sort of the greatest in terms of the potential. You can have a penis that really functions like a normal penis, but it has its risks and its downsides. The alternative is the simpler device, the malleable penile prosthesis, or MPP. Now, this device has no tubings, no fluid, no buttons. It's just these malleable or semi-rigid rods that get put into the penis surgically. So the advantage of this is obviously the simplicity. There's no buttons to push, so it's very easy to use. When a patient doesn't want to have sex, they just bend the penis down and out of the way. And when they do want to have sex, they just straighten it out. And basically, the risks are much lower in terms of risk of an infection is less than 1% in something like this. In terms of the device breaking is less than 1%. There's really nothing to break, so it's pretty rare that you'll see one of these ever break or have a major issue. The downside, obviously, of a malleable penile prosthesis is that it's never really soft. It's just sort of bent and out of the way. So it's not mimicking the normal physiology. Now, most men don't really find it to be a problem. They don't find it painful or uncomfortable. Nobody can notice that it's there because the device is bent and out of the way, but it's not quite natural appearing or feeling. The flip side of that is also true. When the device is straight, it is rigid enough to penetrate, but it's not rock solid like the inflatable one can get if you have a good grip strength. Now, the malleable prosthesis is the most common one used worldwide because of the simplicity and the lower cost of it. And so there are many thousands of men who are happy with their malleable device. It works, it gets the job done, it doesn't bother them when they don't want to use it, but it's not quite as great as the inflatable one. So in my eyes, the malleable prosthesis is sort of the simpler solution. You're less likely to have problems, especially in the long run. It's less likely to break, but you have to sort of accept that this is not quite the same thing as the inflatable one that's going to give you that rigid erection when you want it and completely flaccid when you don't want it. The malleable is sort of the option, the simplest option to fix the problem and have a functional penis with the lowest risk. So for a lot of my patients, it is a good option and it is what I recommend. Depending on their age and other risk factors, it is still a great option to have.